You are a GP and you're presented a patient who has shortness of breath and insomnia. She had an accident 6 months ago and suffered 3 rib fractures. She recovered well but now freezes and becomes tense when she hears a siren or a loud bang. You decide to diagnose her with post-traumatic stress disorder. PTSD occurs when a person undergoes a traumatic experience and months to years later triggers result in intense emotional and physical reactions. Cognitive behavioral therapy seeks to treat this by gradually changing the way someone feels towards triggers. Therapy overlies fear memories by providing the same sensory stimulus in a non-threatening environment. Using a method of memory extinction which was first suggested by Pavlov after he conditioned a dog to salivate at the sound of a bell. It eventually stopped salivating to the bell after the bell had been sounded repeatedly, but no food came. Therapy fails to completely extinguish fear, and to understand why, we need to look at the mechanism of memory. The fearful sensory stimulus projects from the thalamus, where the sensory information is relayed, to the amygdala, which is associated with emotion, in this case the fear neurons. This then projects to the periaqueductal gray, which elicits the behavioral response to fear or pain, and the hippocampus, which is associated with long-term memory. Based on the intensity of the emotion processed by the amygdala, neurotransmitters inhibit extinction neurons to store a memory as long-term and stop it from being forgotten. This explains why you have vivid memories of important events, such as weddings and deaths, and forget mundane details like your breakfast or this video. The medial prefrontal cortex, which is associated with decision-making and reasoning, will excite the extinction neurons and inhibit the fear neurons, and also project to the hippocampus and periaqueductal gray. However, the brain is much more complex than we can comprehend, and this process is not completely effective. Studies reveal subjects display brief removal of fear behavior followed by a reactivation of the fear memory. This process is called reconsolidation and has recently become the focus of PTSD research to further understand the neural circuitry and hopefully extinguish fear permanently and manage PTSD.